Hi, my name is Mark Carpenter. I'm an intensive care consultant and clinical educator in Sunderland, the northeast of England, and this is my first YouTube video on cannulation. There's a video also on my channel which is just me doing a cannula, but this one's got a little bit more chat, a little more PowerPoint, and hopefully a bit more use to you if you're looking to brush up your technique in cannulation or you're new to it. Without further ado, let's talk about cannulas. So, in adult practice, which is my own field of interest, generally people talk about the colour of cannulas, and so pink, green, grey and orange, or brown as used to be back in the day, are the cannulas that people generally use. We generally use the smallest, or a pink cannula for fluid or low flow rates, and a brown cannula if you need to give big volumes quickly. And you can see from the slide that the flow rates in mils per minute are massively different. So if you want to give fluid quickly, it's got to be orange. If you want to give fluid slowly, pink is absolutely fine. Pick your cannula depending on what use you're going to use, and in the next few slides we'll talk about different uses, and we'll think about what cannula you might use in different places. So you call to the ward, Mr. Bloggs needs a cannula, he needs a bag of fluid. His blood pressure is 130/85, his pulse is 85, but he's not able to take any oral fluid, and he doesn't have an NG tube, and I should probably add to this slide as well at the same time. His fluid is prescribed 10 hourly, so 100 mils an hour. What cannula are we going to use? So for this, really any cannula will do, but the smallest is the best in terms of pain on insertion, but also in terms of infection. So go for pink. Bit of a different situation here, and one you're unlikely to be dealing with on your own to start with. However, a 24-year-old man comes in, thrown off his motorbike at great speed. He's hypertensive and tachycardic. Clearly, we're going to need to give some fluid quickly here. And the patient is likely to go to theatre, likely to need blood, and so what are you going to use? Well, I would say something big, grey, brown, big as you can get in, really, in this situation. So it's 2 o'clock in the morning. The nurse rings you, says that someone's patient's cannula is issued, and he needs one for his IV antibiotics. Obviously, we need to think about the patient as well as just the cannula, and so this patient is 5 days into his 7-day course of antibiotics. His white count and CRP has returned to normal. He's well, and in many ways he's ready to go home. So does he actually need a cannula at all? Probably not. So think about oral antibiotics in that situation. And another quite common one, something which is reasonably something you would expect to deal with. The patient needs some blood. It's a routine transfusion, a bit different to the man who fell off his bike. 1 unit of blood over 90 minutes to 4 hours. Again, what cannula could you use here? Again, pink would probably do, but the nurse is probably happy with a green. Pink venflons take a little bit of nursing when you're trying to give blood through them. Most green ones are pretty straightforward. And finally, in terms of which cannula to use, a patient's going to for a scan, and so the radiographers need a cannula to put the contrast in. Depending on what sort of scan it is, depends how quickly the contrast is going to be given, but generally it's pretty quick, and so for that, something like a green venflon is probably ideal. So get your stuff together and get it in a plastic tray which is decontaminated. With most procedures, if you have the stuff together that you need before you get started, things are generally a lot easier rather than having to hunt around when you're mid-procedure. So some gloves, some skin wipes, the cannula itself, a tourniquet, a dressing, and often best to have something like some cotton wool or some swabs just in case things don't go entirely according to plan. Once you've got the tourniquet on, you found a suitable vein, decontaminate the skin using appropriate cleaning device. The EPIC 2 guidance would suggest nowadays that this sort of stuff contains 70% alcohol and 2% chlorhexidine, so not the pink squirty spray that we used to use, which had 0.05% chlorhexidine in it. Once you've done that, allow the skin to dry. and then move on to the next step. So take the cap off the cannula, loosen the white cap, and open the wings, and be good to go. So the most important thing with all these things is your non-dominant thumb. So this is the thumb of your left hand if you're right-handed, which holds the skin and the venflon in place, and so allows you to put the cannula in without it all moving and wobbling around. Lots of times you see videos where people move their non-dominant thumb too early, and so things go a bit wrong if you do that, because the skin and the vein move in relationship to each other. Less of a problem if you're cannulating plastic dummies, more of a problem if you're cannulating real people, and certainly much more of a problem if you're cannulating people who are elderly, in whom the skin is more lax. So keep your thumb in one place, apply some traction, put the tip of the cannula through the skin and into the vein. You'll see a little flashback in the hub of the cannula at this point. Once you've got the needle within the vein, you need to advance things just a little bit, so your plastic sheath around the needle, is in the vein. Then withdraw the needle slightly, maybe 2-3 millimeters, so it sits within the plastic sheet, within the cannula itself. So when you advance the cannula, you don't have the needle showing, so it can't go through the back of the cannula, which is a thing that often happens when people are putting cannulas in to start with. So again, keep your non-dominant thumb still, and advance the cannula with your dominant thumb up into the vein. Once you've got the cannula into the vein, make sure that you continue to apply traction with your non-dominant thumb. And at this point, the cannula's in, so most of the panic's over. So you're good to go with just tidying up from here. With this point, release the tourniquet. I use my dominant hand to release the tourniquet, and then I use my non-dominant thumb. Then I move it now to above the cannula, as I'm showing in the picture. So just then the cannula, place it across the vein, so it occludes the vein. So when you take the needle out, there's less likely to get blood pouring over the patient's hand and on the floor and the sheets and everywhere. Less of a problem with small cannulas, much more of a problem with something big like a brown cannula, where you can lose quite a bit of blood quite quickly and make quite a lot of mess. So you've released a tourniquet, you've moved your thumb, and time to get rid of the needle. So with your thumb occluding the vein, take the needle out of the cannula, pop the needle direct in the sharp spin, which you've had already next to you. Always better to have a sharp spin straight next to you, so you can just dispose of the cannula immediately. Take the plastic cap off the end of the needle and pop that onto the cannula. Once you've done that, apply a clear dressing to secure the cannula, flush it with 5 to 10 mils of normal saline, and remember to document your cannulation. Okay, well, thanks very much for watching. I hope you found that useful. If you've got anything that you want to add, then feel free to drop me a note and tell me what you'd like done differently. Great, thanks.